I'm Dr. Carolyn Burns, and I am a pathologist by my training and had 20 years in private practice. Pathologists are the physicians that we look at tissues and body samples all the time. So part of clinical pathology is looking at blood, whether that's red cells, white blood cells, platelets, the proteins that are in blood, the clotting factors that are in blood. Focus has really changed, and we've really learned how important iron is during pregnancy, not just for mom to sustain mom, but for the baby's development. And that need continues even beyond delivery. So we have to really focus a lot on our soon to be mommies having adequate iron source. The body is asking for much more. It increases 2 to 3 times the need. And then that gets transferred to baby. And that way, after baby's born, they need their iron for all sorts of things in their development, not the least of which is their neurocognitive neurodevelopment. In a nutshell, the reason I got more concerned about my daughter-in-law is she's a vegetarian. She's otherwise healthy. She was active. I wasn't worried in any way about that. And she took the pregnancy very seriously. I asked my daughter-in-law, Leah, please talk to your provider. They did the iron screening. Her iron stores were fine. She did dutifully take her prenatal vitamin and had no issues with that. And the pregnancy went well, and she delivered this beautiful, beautiful little baby boy. Leah told me she was glad I talked to her about it because she wouldn't have thought about it. And it also made a nice relationship for her with her obstetrician, which I think was good news again. In other words, what we're doing is we're coming together, right? And that's all patient blood management, blood health really focuses on. But we want that to all feed into patient-centered decision-making. I will tell you as an aside, I mentioned Blood Works and Owner's Guide. There's an entire chapter on women. And in fact, the byline of that chapter is, if anybody needs to know about blood, it's women. Because from the time we start our periods to when we become menopausal, we have changes in our blood that are just natural physiologic things that occur for women. What's nice about this book is at the end, there's key points. These are the things you need to know. Here's the questions you need to ask. So there's some that you should ask if you're pregnant. There's some that you should ask if you think you might have heavy menstrual bleeding. There are some that you should ask if you're going to have gynecologic surgery. So it really, I kind of was able, because of this book, I was able to, yes, steer her and encourage her to become her own advocate. Ask the whys. So what I'm hoping, too, is now that this young obstetrician got involved with that, she's going to go, you know what? I'm going to read more about this, and I'm going to understand this more. I'm going to advocate for all of my patients in this way. Share the love, right? We get it all out there. I think we have to step into the light and start looking at blood as an organ. And you need to ask your provider about, does my blood look okay? Ask the questions. Be sure to know your numbers and talk to your providers about that. Seek out the advocates and seek out the people that can help you understand what you need. The other thing is, get the book. I mean that sincerely. Get this book. Look at my tabs here. I've given it to so many people to read because they're going in for a cancer surgery. They're going in for a hemostasis, a clotting evaluation. Their kids, their parents, they're male, female, it doesn't matter. I tell them, read through this. This is your life right now. This will tell you the science so you can speak cogently to your provider, but also provides you with the questions. And I've even given this to a couple of my physician friends who said, I didn't know any of that.